Okay, so thank you very much to everyone who joined the meeting today. It's our December information exchange meeting, and we will be talking about mental health services in Hackney during the pandemic. Our guest speaker is Rhiannon England, who will introduce herself shortly. And we will then, she'll give us quite a bit of information on what services are currently available, how we can access them, what is the waiting time as well. We will then give the word to you for any questions and answers. Yes, so Rhiannon, over to you now.
Okay, thank you. Hi, everybody. I know some people, but not everybody. So my name is Rhiannon England. I'm a GP by background, and I'm the clinical lead for mental health at City and Hackney Clinical Commissioning Group. So I was asked to come today to talk about mental health services, especially in relation to the pandemic. And as you can imagine and read in the news and probably experienced yourself from your family or relatives or anybody, friends, there's been a big impact of the pandemic on people's mental health in terms of anxiety, low mood, loneliness. But interesting, and perhaps that reflects the poll a bit, some positives which I think we can build on. In terms of communities supporting one another, neighbours being more supportive, some people feeling less social pressure about going out. So it is kind of interesting, but we have had a very big rise in acute emergencies in mental health, which has definitely impacted on the other services. So I'll talk about that as we go along. So what I'm going to do is I've got a few slides which we're going to start, and Canary is going to very carefully work for me because I'm a bit incompetent, and then there'll be plenty of time for Q&A at the end. So I thought I'd start with children and young people, and I think it's important because of the pandemic to talk about what services in Hackney are available for self-referral, because if you don't want to go through your GP, if you can't get access to your GP, or just anyway, because people should be able to self-refer for help, we do have a lot of services actually which do not require you to talk to anybody. You can go directly to the services. So just to start with children and young people's services, young people have definitely been affected by the pandemic. Shut up more at home in difficult circumstances, or just not being able to access friends or education. So what we've got in City and Hackney is, for self-referral, is we have First Steps, which is a child psychology service, 0 to 18. Obviously the noughts don't refer themselves, the parents refer them as a family. But you can refer yourself for if you're having problems with your younger children or even older children, and adolescents can refer themselves. The waits, sadly, for First Steps used to be really good. They would do assessments within 4 weeks. The waits are much longer now, and we're having to cope with that, although they are coming down. So there was a block on self-referrals for First Steps. They were only taking professional referrals. They've now opened again to self-referral. It is mostly still online, but they are doing face-to-face. And that's for mild to moderate issues, as indicated. What else we've got for young people is we have the sort of children's version of the Crisis Cafe for adults, which is called the Cool Down Cafe. At the moment, that's exclusively online, and it's a Thursday evening. Really sad. It was about to launch. Well, it did actually launch, but it didn't get properly going as a face-to-face service. It's in the Pembury Children's Centre, but it does do online stuff, and that's I think going to be when the pandemic is finished. I think that will be a very successful and popular offer for young people, and it is actually a cafe as well. And then we have Cooth, which is a very well regarded online support and counselling service for 11 to 18s. I'll come back to what Cooth do in Hackney, but that is certainly self-referral. Next slide, please. So the other services are professional referrals. So CAMHS and CAMHS disability can be from referrals from GPs, nurses, education. They are also experiencing longer waits. They will try and do a 4-week assessment response, longer waits for treatment. We do have a CAMHS crisis service now, which works 7 days a week. And we have a CAMHS crisis line, which is part of the adults line, 24 hours a day, 365 days a year. The CAMHS crisis service has been extended. It used to be 5 days a week, and we are extending it. We are required to extend it for 24-hour cover, but over 90% of referrals come between 9 and 9. And then we have off-centre commissioned, which you probably know used to be a very well-regarded voluntary sector organisation in Hackney, which is now been combined with Family Action. They are very oversubscribed, and we know that. They are hugely popular with young people, 16 to 25s with more complex issues who don't feel they get the right service from adult services, but it's a real issue. I just thought you might be interested in Cooth. Gives a lot of feedback about why the young people use them and what has happened in the last year. So you could say that's sort of COVID related. And it is sad. I mean, I'm looking at sadness up 128% from last year. Loneliness. We don't tend to think of young people being lonely. They are very lonely, even with all the digital, or you could say because of all the social media and digital stuff. Sleep issues, and then sadly more serious things like sexual abuse. Next slide, please. So we also have a lot of additional community support within what's called the CAMHS Alliance. So for children and young people, we have a Growing Minds project, which is for Black African, Afro-Caribbean young people and their families. We have some projects with the Haredi community, and we have Wellbeing in Schools, which is called WAMS. We have the Turkish and Kurdish speaking parenting groups, Muslim parenting groups, and as you can see, LGBTQ+. And we also have invested more into the bereavement service in St. Joseph's, so that St. Joseph's can see adults and children and families. And that's obviously very important during coronavirus. Next slide, please. So moving on to adults, again, the need for self-referral and be able to access mental health help yourself. Talk Changes has been around and has always been self-referral, actually. I mean, the good thing about Talk Changes is they have a huge load of therapists, and they see people who have anxiety and depression. There are no waits, really. You can refer yourself, you get and it is, again, we'll come back to that, almost all online now. So you have a telephone assessment, you get online therapy. But the good news is there's no waits. They will do face-to-face. So for people who don't have either phone access or digital access, they will see you face-to-face. The other thing that we have in Hackney is SUN groups, so service user network groups for people with more severe mental health issues. That's a group run by the service user themselves with a therapist, sort of co-run groups, very popular. They've all gone online now. Hopefully when coronavirus burns itself out, they will go back to face-to-face groups. We currently have 5 in Hackney. I think we're moving to 6 soon, and they are in a central location now, or they were before COVID, but we're talking about moving to more neighbourhood locations. The Crisis Cafe still works, mainly online, but some face-to-face. And the Recovery College for people who've had severe mental health problems and who are in their recovery phase, they have moved to mainly online courses. That's all self-referral. Next slide, please. So the sad news is that psychiatry will still have a 4-week wait for assessments. Psychotherapy, our waits have gone up massively, and it's a major issue now. That was because a lot of the therapists were moved during the first wave of coronavirus into acute services and crisis services, because we needed to not have people with mental health crises mixing with acute COVID-infected patients in A&E. So there was a big move to move the mental health presentations out of A&E, and the therapists were redeployed. The other bad news is our neurodevelopmental service, ADHD and ASD, so which is autism. Long waits for assessments now. Same reason, the therapists were redeployed. That should come down quite quickly, but they are mainly doing online assessments now. But actually those are very popular, I have to say, with patients. So I think that will continue in some form anyway, and I don't think we will ever go back to having total face-to-face assessments. I think it's a lot of people find the online assessments easy, and obviously no travel time, etc. Next slide, please. Just to indicate, you might know about this, but when I talk about talk changes, it's the psychology services for people with mild to moderate anxiety, depression, quite a lot of other things really, abnormal grief reaction, some post-traumatic stress disorder. There are in Hackney community sector organisations who also are involved with our talk changes or IAP service. And so one of these is iRemind, and it just mentions on the slides lots of things that they are doing. Next slide, please. Derman, obviously for Turkish and Kurdish speaking residents, and they are also part of the IAP service. Next slide, please. And then Bikr Halim for the ultra-Orthodox Jewish population, also provide an IAP compliant high standard mental health service. Next slide, please. And it just goes to show that having voluntary sector contributing to treatment of people with mental health difficulties has been really successful. So at the moment that service is top in London, and if you look, the 3 voluntary sector organisations are top of top for recovery rates. So it's fantastic, really. Next slide, please. So, okay, I mean, you probably know all this really. What have been the specific COVID challenges, and what have we done about it? So we have done a lot of getting people with severe and enduring mental illness to have personal budgets for laptops, phones, getting people connected who didn't have those opportunities, so that they could contact their GP, they can book appointments. Funding into bereavement services for adults and children, as I mentioned. We contributed to the mental health service information into the council's COVID helpline, so that people ringing up for general help around money or food, but who also mentioned problems with mental health, could get linked into advice. Texts out via patients to patients via GP surgeries, informing people about what was available, including self-referral. The Mental Health Trust moved to doing home visits for depot medication for patients, and for some other patients who could not leave home because they were shielding. And also mental health support for care home staff and NHS staff. Next slide, please. I think that's particularly important to remember. Some very, very stressed care home staff and staff at the Homerton, for example. And, you know, it's been good to be able to provide some easy local support. So our challenges, well, digital poverty, obviously, or unacceptability. It's not for everyone, laptop, phone, And it is an issue because quite a lot of the mental health staff were either off sick or self-isolating or shielding, as well as patients also self-isolating, shielding. That did get a bit better and is now sort of going a bit back now that we've hit tier 3 again. Loneliness and social isolation, as I mentioned, I think sadly what I'm sure is that post-COVID, the effects of social determinants of health, which are massive effectors of poor mental health, if you like, will get worse because of austerity. So we are expecting increases in crisis presentations, pressure on staff. However, the good news is that online services where people do engage are reporting really good outcomes, and obviously very low do not attend rates. It's more productive actually for all of us, although a bit strange not to be seeing somebody face to face. I think that's it, isn't it? Is that the end?
Yes, that was the last slide, Rhiannon.
Excellent. So that was a sort of trot through, and I've seen in the chat, I mean, you're very welcome to have any of those slides, yeah. No problem from my point of view.
I'll send them around after the meeting.
Great, and I'm very happy to try and answer some of the questions. Kamna, do you want me to answer the 2 questions that came in before?
Yeah,
or to talk about them?
Let me just very quickly bring them up now, because we've been receiving some questions from residents who are not able to attend today. So one of the questions were, what is the waiting time currently, which you already answered, Rhiannon.
Yeah, I mean, it's very variable. As I said, there's some services with no waits, and our biggest wait for adults is for individual psychotherapy. And we to be frank, we're going to have to move to group therapy as practically the only therapeutic offer from a psychotherapy point of view, because we cannot manage the waiting list and the numbers, and we don't have the capacity, both funding but also of therapists, to cope with the individual therapy needs. We're also going to get a bit more strict, I suppose, about people who've had therapy already, and I'm talking about full psychotherapy. Now, I'm not talking about some counselling sessions, but those people might have to wait again before they have more. Yeah, so that is not a good situation, and as I said, the off-centre waits are very long, but we'll get those better actually.
Very good. Okay, so the next question was, what is the support for those who do not Zoom during lockdown?
Yeah, well, all services will offer face-to-face, but it's likely to take longer and be more difficult, you know, because, and then there's all, as everyone knows, there's all the difficulties: travel, space, the fact that social distancing means they have to reduce the number of people in the building. So all those mean that face-to-face will be longer, but all services should be offering some face-to-face. So if people can't Zoom or they don't want to do it by phone, they will be seen.
Right, so is there an option for telephone consultation or telephone sessions,
yes.
perhaps?
Yes.
So that might be an option for those who do not
Definitely.
Zoom.
Yes.
So this is also offered.
Yeah, it's definitely offered. All talk changes assessments, for example, are by phone unless the patient requests differently. So phone, definitely, yeah.
Excellent. All right, I'll quickly continue with the rest. How patient or carer can get support from clinician during lockdown? That was one of the questions.
I think in the same ways as before. So either self-referral or go through your GP in the first instance. And the GPs should be working. Again, it might be by phone or by video. But, you know, you can certainly and should be contacting your GP if you've got any concerns.
Excellent. And this is a very interesting feedback, and I think very important feedback from a patient. So the resident said, because phone queue times are longer during lockdown, those on cheapest pay or low contract are finding that the whole of their minutes can be used up while on hold sometimes without getting through at all. There are no calls until the rest of the month. What is the provision to send a text asking for a call back?
Yeah, I think that's a really good point, and I'll have to take that away because I started to ask the services about this. I mean, what if you're talking about phoning your GP, that's one thing. If you're talking about phoning the therapist, in a way, the therapist should be phoning you if it's for an appointment. So Talk Changes should phone you. I totally agree that. So we did have a problem with the crisis line, which was,
that's what I wanted to say, really.
Yeah, which was a pain. I mean, that was horrific because I thought that had been sorted years ago. So it was pay line. It's now free, and we have insisted that those, if secondary care mental health services are phoning the patient, you know, they should be picking that up, and if the patient is phoning them, it should be a free line. So definitely, that's a really good question, and I'll take that back because that's just unacceptable.
Excellent. Thank you very much, Rhiannon, and we'll look forward to hearing about it more soon, hopefully. Okay, so these were the questions sent to us, but I can see on the chat box that people have asked about. So Gulner says they are running COVID-19 response project and happy living project to support emotionally and welfare support. Yes, Gulner, we will share the slides with everyone after the meeting. Anyone can refer people to us. Can you remind us which organization you are from, Gulner? Gulner, are you here? Maybe we'll come back to you. Gulner, can you hear us?
Canaria,
Yes,
can you
yes.
hear me?
Yes, we
Yeah,
can hear
I forgot to write in my note. It's from Turkish Cypriot Cultural Association, and we are based in 14A Graham Road, but I will be sharing proper written information so you can distribute amongst.
Yes, please do, so I can include it in the email.
Yes, okay, I will do that.
With a short description as well of the services. That will be
definitely. Although we don't have a befriending service currently, but we do it informally amongst our other project, like a Happy Living project for over 50s in Hackney. It is part of a research program, but we are offering WhatsApp chat group, weekly Zoom meeting, and we can support by, befriending who speaks Turkish directly. So any Turkish speaker could be referred to us as well within
very
Hackney.
good. Very good.
Yeah.
Thank you very much, Gulner.
Thank you.
Shirley, I can see that you would like to ask a question, so please go ahead.
Thank you. And thanks, Rhiannon. That was a great presentation. And it does look like a really good provision that City and Hackney are making on the face of it, I must say. So well done, City and Hackney in general, and also particularly in difficult times to be making that kind of provision, which is encouraging. So one question, just to increase my knowledge about something, I was a bit surprised to see a category going from naught. I was just wondering how you recognise mental health problems in a naught child, or if you've got some idea, if there is some idea about when it is possible to start recognising and measuring mental health problems in small children. And if there is a sort of age thing, why do you start from naught, on the thing? Maybe just change it to whatever the year is, if that exists. And then the other thing is a lot of information about provision for young people of varying ages, which is great. Didn't see anything at all about older people.
Thank you, Shirley.
Yeah, I can answer that. So the 0 to 18, of course, so I'm really keen on the mental health of 0 to 5s. What does that mean? Does that mean 0 to 5s get mentally ill? No. Does it mean that they need their emotional well-being is absolutely 100% key in those years? Yes. So, of course, if you're talking about the 0 to 5, you're talking about families and parenting. and behaviour, and so the mild stuff. But for me, it's absolutely vital, and not because we don't want to have any gaps. So if you're a pregnant lady, you can access the perinatal mental health service. When you've had the baby and the baby is 0 days old or 1 day old, you can still be in that service, but you also may need help with attachment or managing your baby if you've not been so well. So I'm a real promoter, and it's obviously very promoted by health visiting, about how to have a happy child, really. I think, you know, we go on so much about weaning. I mean, as a GP, I used to get totally mad about seeing endless people about weaning their baby and sleep, and yet nobody really said, how do I have a happy baby? And I think we really need to push that, actually, in Hackney. So that's why 0 to 18.
Fantastic. That's a great answer. Thank you very much. Yes, a lot wiser now. Thank you.
The older adults, yeah, you're right, actually. I didn't put anything. I talk changes and the offers for self-referral are all age over 18. So, you know, you can be 90 and refer yourself to talk changes or the crisis cafe or whatever. You're right in that the community mental health team, yes, the older adults community mental health team would see people if they are more elderly and have more severe problems. And I think their services have been running throughout coronavirus, actually, and I don't think they've been too impacted. I think the dementia services have been, because a lot of patients with dementia who are in care homes obviously have been very affected by coronavirus. And that has been very sad, actually, for us. Probably less severely affected than some other boroughs, but we still obviously have lost quite a few people with dementia. And the dementia services have had to run with home visits with full PPE and also online, which is very difficult for people with dementia unless they have carers who can operate phones or videos. So yeah, that's been challenging. And I can't remember the last bit. There was another point, but I can't remember it.
No, I think that was it. Thank you. It's about older people. So could we maybe have an extra slide so with some information about the services for older people?
Yes,
that would be great.
That.
Thank you
Very good.
very much indeed. Thank you.
Yeah, thank Rhiannon, and thank you for the good presentation. Really useful. We have another question from one of our board members who's asking, how have community mental health teams been impacted? Also, what services are provided by or in conjunction with adult social services? Thank you, Philip, for the question.
So I think community mental health services, it was a sort of very difficult time, because just before coronavirus, in City and Hackney, we're going through, well, in the 3 inner northeast London boroughs, actually, Tower Hamlets, Newham and ourselves, going through a big transformation of our community mental health services to be more aligned into neighbourhoods and networks, and to be less, well, just to be a broader offer for people. So to link up with all the offers in primary care around social prescribing and well family and well-being. So that was great, apart from coronavirus sort of hit, and then the community mental health teams were sort of in 2 places. So they were trying to do the neighbourhood work and also the sort of old secondary care work. I think they very rapidly had to adapt to serving people with severe mental illness. So doing home visits for people, as I said, to do depot medication by injection, or they had to keep running the clozapine clinics because people need blood tests. So it got diverted into emergency care. I think they tried very hard to keep the more regular and less severe people phoned and kept in contact. But yeah, it has been a really difficult time. I think going forward now, as they move to the neighbourhoods, it actually will be a lot easier, because there'll be a very sort of multidisciplinary approach. In terms of working with adult social care, I don't know, actually. I mean, I think adult social care, again, during coronavirus, have been massively stretched. The council helpline for people with coronavirus, I think, has been absolutely amazing. I think the council have done a brilliant job. And adult social care have been having to cope with all the care home issues. So I think they have been very stretched and very pushed into emergency responses. We've been working very much with them around the care home testing response, for example. So again, not a more general approach in terms of mental health, but a kind of COVID approach. Going forward, I think the good news is that there's going to be adult social care in each neighbourhood. Well, there is now, actually. And so again, the neighbourhood working will be much more joined up in what has been a pretty fragmented sort of effort before, with social services being quite remote from mental health. But so hopefully that will improve.
Excellent, thank you very much. Malcolm, please.
Hello,
Yeah,
hello, Rhiannon. I just want to ask you a question about psychotherapy, because you mentioned before about group therapy taking the place of individual psychotherapy. And but is it the same thing? I mean, surely when you're assessing somebody, you're actually assessing them for a particular type of therapy. And to say that the group therapy is the only service available kind of seems to me to suggest that some people for whom the individual psychotherapy would be more important or more fundamental to their treatment are going to miss something. And also, what about people whose first language isn't English? How do they receive psychotherapy or group therapy services?
Yeah, thank you. I mean, there's going to be exceptions. When I say it's going to move to, well, it has moved to a mostly group therapy. There are some conditions like severe trauma, which is not good to do in groups. So of course they will have one-to-one therapy, but actually the outcomes for most people for psychotherapy is as good in groups, if not better. So most people come and say, no, I don't want groups. They are persuaded to try groups. Their outcomes are better. So you probably think, well, I would say that anyway, because it's cheaper. And frankly, it is cheaper, but it's not really about the money, actually. It's about the numbers we have waiting. And we cannot leave that number on the waiting list. The other thing we're doing is we're looking now at therapy as part of the picture. But now, if you go to your GP and you request psychotherapy, or your GP feels you need psychotherapy and you're referred, therapy will be part of the treatment offer. We should have done this years ago, frankly. You have to do a lot of work, not just in therapy, but to improve your well-being. And you can be helped to do that by therapy, but also we need to use all the other services available in the community. You know, the yoga groups, the mindfulness, the social prescribing, the volunteering. So it will start to be, this is a package of care for your mental health, of which one element is therapy. And I think that's a really good change, really. But you're right, there will still have to be the exceptions. People who English as a second language, of course, unless there happens to be enough and a Turkish speaking therapist, for example, to do a group or whatever. I mean, it does sound a bit drastic because our weights, you know, they are drastic now. And we have to address it. And in the same way as people coming for repeat therapy, we're going to have those difficult conversations, which is we can't, you might not be able to do that. You might have to wait, or you might have to go to low cost therapy and pay a small amount, or perhaps it's just, you know, you don't need that and you might need something else. I think we've got, in Hackney, we've always had a lot of provision, which has always had a bit of a waiting list. But we've always had a lot of people who have more than one therapeutic treatment, and in a way, we've got to have that available for everybody, not for the few people that might need ongoing support. We're going to have to provide that ongoing support in a different way. So difficult conversations, very difficult conversations, but you know, our job is to provide therapy for everyone who needs it, and that hasn't had it to start with. And then, you know, we need to sort of work out what else we can do to bring all the bits that we've got in Hackney, which is an awful lot, and with the voluntary sector, into play. So it's not just about, you know, your 20 seconds of psychotherapy. It's a whole lifestyle sort of help.
Okay, thank you very much.
Okay, thank you. And there is another question in the chat box as well regarding the eating disorder. For a young person with an eating disorder, 4 months is a long wait. Presumably, it's best to intervene at the early stage. So what are the plans to improve this? And is there a specialist service?
Yes, I would be. I mean, if they know of anyone that's waited 4 months to see to have an eating disorder assessment in Hackney, please send me the details, because we have a very good young people's eating disorder service. So first of all, I'll talk about the under 18s, because the over 18s there are problems. So under 18s, we have a very good eating disorder service. You should be seen if you are unwell and losing weight rapidly. You will be seen within 2 weeks. 1 week if it's decided it's an emergency.
And is this in Hackney?
This is in Hackney. If anyone under 18 is waiting longer than that, they should tell me. Over 18 is different. Over 18 adult eating disorders has until recently been commissioned by NHS England. So as from our clinical commissioning group, we didn't have any say over that. Now it has been, they have a adult eating disorders collaborative, and our local provider of eating disorder services for adults, which is St Anne's, is part of that. So there have been issues about adult weights, but now the collaborative are involved. We're trying to get down so we have the same standards as children, which is a 2-week wait. It's going to be, that's going to take 6-9 months to progress, because it has been a mess. That's for adults. So again, if it's an urgency for adults, they should be seeing you within 2 weeks. If it's not urgent, it might be taking a couple of months. And no, it's not good. But for children, there shouldn't be that wait at all.
So for children, the assessment is within the 2 weeks.
Yeah.
And then what about the treatment? When the treatment was the same?
You start your package. You start your package.
I see.
Yeah.
Okay. And with the adults, you said usually within 2 weeks, but it can take longer.
If it's an urgency, they will see you within 2 weeks, but most people are waiting a couple of months. And we used to have this ridiculous thing where the GPs had to refer into East London Foundation Trust, so our local trust, who then had to sort of sieve the referrals and then send them to St Anne's. And this is just a historical thing that NHS England had. We've stopped that now. We are moving to direct GP referrals to St Anne's, and they are also putting funding into bringing waiting times down, having local clinics. So they're going to do a local clinic in Stratford for East London, which will be a lot better for, certainly for Tower Hamlets and Newham, and for our patients in Hackney living in the Stratford end. Because getting to St Anne's has also been a problem for a lot of people in Hackney. It's not an easy place to get to, really.
Yeah, so in between this couple of months while the adults are waiting for treatment, is there any place that they're signposted to, or any group sessions or anything that these people can access while waiting, or they're just waiting?
That's a very good point. I don't think so. There's again, under 18s have a website called Beat, which provides a lot of online support. But that's a good question. I'd have to ask about what St Anne's do about adults. I don't know, actually. I'll have to find out and let you know.
Okay, thank you. That will be useful. Okay, any further questions for Rhiannon?
Yes, I did have another one, and actually it relates to what you've just asked, Canaria. Is that okay if I go ahead?
Yeah, please
thank you. Because I was going to ask, I think it was for the 16 to 25s, there is some provision that you said that is an 18-week wait, I think, for assessment. And I was going to ask whether there is any system whereby they might anonymously be put in touch with each other so that they could talk to each other while they were waiting. So that kind of bit relates to what Canary has just asked. I don't know whether that is technically possible or desirable. I would have thought that could be, some people might want it. I don't.
I'm not sure how that will fit in the GDPR, really.
I think that's the issue. And also, I don't think professionals would feel comfortable putting young people in touch with one another who haven't had an assessment. I think post-assessment, you know, I think some of the groups that off-centre run are really, really successful. So the LGBT group, for example, has continued during COVID online. In fact, I think they've moved to 2 groups, and that's a very successful kind of both self-help but also professionally run sort of therapy group. So I think certainly after people have had assessments, I mean, people, you know, choose what they want, and I think the 16 to 25s really love off-centre. The other thing that we're trying to do is to get talk changes to have, and they are doing that now, specific young people's workers, so that again that is more friendly, more youth-centred. And I think it's the way forward if we're also connecting up and having employment advisors in off-centre, and so making it a sort of 16 to 25 mental health and well-being hub really. And slowly we're adding bits in. It's a great resource, but it's very, very oversubscribed at the moment. We're putting more funding in, so that will come down, but at the moment it's not so brilliant.
So, but would that group be sent something that says, in response to their request, would they be sent something that says there is a wait for assessment, and in the meantime there are these services which you might like to get in touch with while you're waiting?
Yes.
Would they have that? Yes.
Yeah, off-centre are really good like that. They will contact people and then they keep in contact. So you get phoned once a week. You know, how are you? Really sorry we haven't seen you yet. We know you're there. I think that's so important actually, and people really value it. It's what the Sun group do for adults. They text their members. So you join your Sun group, you might not go, you might go once a year or something, but you'll get a text now and then. How are you? You know, we're meeting next week. Are you okay? And what people have said is that's just so wonderful to know that they're there. They still might not go to the groups, but they feel a part of it. And so I think that's really great. Yeah.
Yeah, that is fantastic. Thank you very much.
Good. Very good. Thank you. Any more questions? Yes, Gulnur.
Yeah, can I ask a question to Rhiannon? If there are a lot of waiting time for Turkish-speaking community, could the service referrers like Mind or other organization who refer people for mental health support to counselors or psychotherapists, can they refer to us in the meantime while they're on the waiting list if there is a long wait? I heard that one time was like 6 months waiting, because we support people by we have a WhatsApp group for over 50s, although this one, but we also have separate another WhatsApp group for any age. So they can just say hello, say how are you, share videos, pictures, just information, so we can add them there. And also we are running, initially it was weekly Zoom meeting, but now we decided to do it every 2 weeks, because every week seems a lot. People fed up and their telephone data, internet data is not enough. So this is one of the disadvantages. So would you be, cooperating with our organization for Turkish community?
That sounds great. I mean, if you send me, Kanari's got my email. If you send me an email, then I'll obviously connect you up with whoever really. But that sounds great to be part of that pathway, and I think that really helps people who are waiting a long time not feel completely abandoned. So I think that would be great. Thank you.
Good. I'm more than
I
happy
share
to
my detail on the WhatsApp chat, my email and our organization. Could you do that as well when you are not speaking?
Yeah, sure.
Your email and the organization name, please.
Yeah, I will.
Thank you.
Excellent. All right. Thank you. Any more questions for Rhiannon so far? I think the presentation was very explicit anyway. Thank you, Rhiannon. Now, let me see the chat box. Okay, we can see Rhiannon's email. Thank you for sharing that.
Yeah, and I'm City and Hackney CCG. I'm the mental health lead at City and Hackney CCG.
Excellent. All right, so yes, I don't have any further questions at this point, but I hope, Rhiannon, you wouldn't mind if there are any coming after the meeting, I can pass them on to you, and then we can share answers as well.
Sure, yeah.
Okay, yes, Gunnar.
Really sorry. Sorry, I was typing, somebody called me and I was typing, I will call you back. Sorry, who said that I am the head of mental health CCG? Was it Rhiannon? Who said that I am?
I'm the clinical lead. I'm certainly not the head. I am the clinical lead for mental health in the CCG.
Okay,
So I'm
thank you.
part of the team, that's all.
Yeah, I didn't see who was talking. Thank you. Thank you.
Okay, that's fine. All right, then, if there are no more questions for Rhiannon, I would like to thank you very much for the excellent presentation. Again, very useful information. Thank you. And we'll be publishing this video on our YouTube channel and hopefully share the messages on our social media and newsletter with our members as well. Thank you everyone for joining. That was the last information exchange for this year, but hopefully next year we'll continue providing this information to many different important topics related to health and care. So please continue following us, keep an eye on the emails, and happy holidays and Merry Christmas to all who celebrate it. Thank you very much for attending, and we'll see you next year, hopefully. And I'll be in touch by the end of the week with details from this meeting today. Thank you.
Kanarya, will you be sharing the notes as well, the chat group messages?
Yes, I will.
Thank you. Thank you.
It was a really good session.
Thank you, Shirley.
Thank you very much.